Emergency pop quiz, and today it is a true or false question. Initiating active warming before fluid therapy resuscitation can result in circulatory shock. True or false? So here we have a patient who is not only cold, but requires fluid therapy resuscitation or bolus fluids, so is likely hypovolemic here and in shock. So do we want to start warming this patient before we deliver the bolus fluids? Generally not. We always want to try and establish a normal blood volume before we then go in warming this patient. And that is because this patient is in shock and will probably be vasoconstricted in the peripheral vessels. And that is helping to maintain cardiac output and blood pressure. So if we go prematurely vasodilating this patient in the peripheral vessels, then we could cause a further reduction in cardiac output and blood pressure and therefore circulatory collapse. So we want to be really careful rewarming these guys prior to administering fluid therapy. The other thing that can also help is warming the trunk only, or focusing the heat on the trunk of the patient and leaving the limbs out to slowly vasodilate, again, to try and avoid collapsing the circulatory system.